Our special guest today is Dr. Robin Rutherford. He is with the Art of Dentistry in Odessa. Thank you for being with us today.
Enjoyed it.
New technology here to the Permian Basin in laser dentistry. Tell us a little bit about this.
Okay. Well, lasers have been used in medicine in a lot of ways for a long time. You think of ophthalmology as laser surgery, things like that. In fact, I hurt my shoulder snowboarding about a year ago, which maybe means I'm too old to be snowboarding. But anyway, the physical therapist actually used a laser in ways that they helped my shoulder to heal. So anyway, in dentistry nowadays, lasers are also being used in a couple of ways. Number one is for cosmetic dentistry. For example, if you have, you're going to do porcelain veneers or something to make your smile look nice. If your teeth are level, unlevel, the gum line does not match and it doesn't look symmetrical, it's not going to end up looking as pretty. And so with the laser, I can actually raise the gum line and make things level out, and it'll look like a lot prettier result. So that's one way.
This also helps in gum disease. Tell us how it can help you out in healing better.
Right. Well, gum disease, the main thing you're going to do with gum disease is you've got to get things clean. And so having your teeth cleaned thoroughly is part of it, sort of mechanically cleaning off tartar and things like that. But the new thing is that with lasers, we can actually help the gums heal better and faster around the tooth. It can kind of remove the infected material and stuff, and so that the gums heal faster. And in fact, in dentistry, it's been used before in other states, but in Texas, it's only been the last couple of months that Texas is allowing hygienists to use a laser. My hygienist and I went to Kansas 4 years ago to learn about lasers and how it could be used when we knew it wasn't even allowable in Texas yet, but we knew that sooner or later it would be. And here it actually is, a little laser. It's only this big. It's about like a Sharpie marker.
Right, looks like a pen.
Yep.
But it actually does so much more.
Right.
Very interesting. Thank you so much for sharing this with us. We also want to share a tip of the day for you today. This can happen at any moment. Your crown falls off. Say you're traveling, or with Halloween coming up, maybe you eat too much candy that weekend, can't get to a dentist right away. What kind of tip do you have for everyone? Okay,
well, if your crown will go back on the tooth and you can put it back on, and the bite feels the same, so you can put it back in the right spot, what to use to keep it on? Well, number one, you can just put Vaseline inside it. Vaseline will sort of waterproof it and insulate it, and it's sort of sticky a little bit. You can also use toothpaste the same way.
Okay.
Put a little bit of toothpaste in and put it on. So denture adhesive is something you can buy, put a little bit in there. So that's several things that are readily available.
Great. Remember, that's a temporary fix. You need to go get the permanent fix as soon as you can.
Something is wrong.
All right. Thank you so much for sharing this information with us. We appreciate it. If you'd like more information, of course, you can always call Dr. Robin Rutherford at his office number you see there on your screen. Thank you very much. We'll see you next time. When we return, Chief Meteorologist Greg Morgan will have a look at your weekend forecast. Stay with us.